What's a mistake a doctor made that left you dealing with the consequences for the rest of your life? Story 1. My doctor ignored my very vocal concerns about the pains and strange symptoms I was having during my twin pregnancy. She missed all the classic signs of twin-to-twin transfusion syndrome, many of which I brought up to her. This led to me not having the treatment soon enough in time to save them. I remember having to decide whether I should bury them or cremate them. Those were the blackest and darkest days of my life. Answer: I am so sorry for your loss. After being pregnant, my one piece of advice to pregnant people is, if you have a concern and you feel dismissed, ask for it to be documented on your chart. I'm glad you think this is normal. Can you document on my chart that I was concerned about XUCUCUCIA and further tests ultrasound labs weren't needed? That'll get your doctor's attention real fast. I hope you're doing better now. Edit. Spelling. Story 2. I had a tumor in my colon. Over time, it grew and grew and grew, and I suffered multiple symptoms because of it. My doctor decided that my symptoms were PMS female problems, even as they escalated. He told me to take Midol and get over myself, that women either deal with their issues and get on with life, or lie around whining and wasting people's time. Eventually, the tumor caused a 100 bowel obstruction, and my body started to rot from the inside out. I can't even describe how painful that is. Anyway, I ended up in the ER, was sent for immediate emergency surgery, and ended up having part of my colon and necrotic tissue removed and with a colostomy bag. I went from being a very happy, physically fit and active person to whatever the hell shell of a person I am now. Answer: I just wanted to reach out one bag wearer to another. I don't know if you still have your bag or not, but I cannot imagine the shock of just waking up with one. I had a few weeks' notice, but I also knew it would be a possibility. I hope you are okay. My bag changed my life for the better, but I know I was lucky with a great support network and doctors who listened. Anyway, virtual hug from an internet stranger with no bowel. Story 3. When I was in labor with my daughter, her heart rate would plummet with every contraction. Every time we questioned it, the nurse would tell us that it was just the monitor slipping. I went in at midnight, had a long labor, and was not examined by a doctor until an hour before she was born, around 2:30 p.m. the next day. By that time, she was in the birth canal and could not be delivered via C-section. She had the cord around her neck and was born blue and not breathing. They revived her and she seemed to be okay. It was months later, when she wasn't hitting the normal milestones, that we realized something was wrong. She has cerebral palsy and is intellectually disabled. She uses a wheelchair and has to wear diapers. She will be 29 next month and she still lives at home, and we still have to care for her every need. I love her unconditionally, but I always wonder if that nurse had paid attention and gotten a doctor in there on time, how different our lives would be. Story 4. After a bad fall, doctor dismissed the foot pain as a sprain and only operated on the knee. Foot pain continued, but they said wait till the knee heals to be sure because of insurance. If addressed at the time of the injury, insurance would have covered the foot. End result, foot surgery a year later, but it has permanent damage that could have been fixed if they had addressed it right away, and now I have a limp. I'll never forgive them their short-sightedness. I've summited multiple 14ers, but I never will again. Edit. Thanks for the positive feedback, y'all. Story 5. I had some pain in my mouth. It felt like it was radiating out from my tooth. I went to my dentist about it, and she said, "Oh, you have a filling on that tooth. It's probably just a little sensitive." And she prescribed me some toothpaste. It worked for a while, but a year later the pain was back. With a vengeance, I went to a new dentist. It was the same drill. A year later, new dentist, same drill. Eventually, it got so bad that I was crying in pain. I woke every day with a horrible headache. My teeth were cracking and ground down because it hurt so much. So finally, I go to a new dentist, crying in pain, and she sees what she thinks is a strange growth in my mouth. She has me get an exploratory root canal. The dentist who does it, another one at her practice, since she didn't have time, ABD, I wanted to do it fast, tells me that I'm wasting my time and nothing is wrong with me. He eats his words really fudge quick when he sees that I've got a pus abscess under that tooth and all of my nerves there are straight up dead. I've now switched dentist again to a woman who, when I said I was having pain, immediately sent me to a periodontist, no questions asked. But unfortunately, I still have to live with the cracked and ground down teeth and still likely have to wear a night guard for a long, long time. Story 6. Tetracycline as a child. I am not allergic to penicillin, and it ruined my teeth, turning them black. I already had a difficult childhood, but never wanted to smile because of it. I had veneers done in my 20s, but the damage to my self-esteem has been pretty terrible. Answer. My husband and I both have tetracycline gray teeth because we both had recurrent tonsillitis as kids. In fairness, they didn't have much else in the way of antibiotics back then, and strep infections leading to rheumatic heart disease were them common and much feared. My dentist later said we were at least lucky to have had enough tetracycline throughout early childhood so that our teeth were of a uniform color. A lot of kids our age had a noticeable gray stripe across otherwise white teeth, the result of a single tetracycline treatment before permanent teeth came in. Story 7. It started with a very loud ringing in my ear, then violent bouts of vertigo. I went to my PCP because I was pretty sure I'd lost hearing in that ear. I will never forget. 28. Or old women don't go deaf in one ear, you're imagining things. He said he could make a referral to a neurologist, but it would be 3 to 6 months. Paid out of pocket to go to an ENT, couple $100, who immediately ordered a CT scan. Thankfully not a brain tumor, but nerve deafness which could have been prevented by steroids. Another kick in the pants. Insurance didn't cover the CT scan either. If you'd had a brain tumor, it would have been covered, but aren't you glad you don't? Answer. Was it labyrinthitis? Same thing happened to me a couple of years ago. Felt like I had food poisoning, vertigo and nausea, and then all of a sudden, hearing loss and tinnitus. Went to the ER after a couple of days where the DR said he couldn't see any reason why that was happening, so gave me a referral to ENT. 3 months later at my app, the ENT specialist, said I'd be fine if I'd been given steroids within a few days. Now I have permanent tinnitus. Story 8. It was an orthodontist who decided to straighten my initially not-so-bad bite and may not have been well qualified in maxillofacial orthodontics. As a result, this led to clicking, crunching, and pain. I've heard that many people experience similar problems. If anyone else has this issue, please let me know. A hug. Answer. I'm genetically missing 7 or 8 of my adult teeth. This led to significant teeth gaps as a kid, so when I was about 11 to 15, give or take some months, I had braces. Almost 20 years later, my bite is a mess. My teeth are moving. The fake tooth material they put on my real teeth is chipping slowly away, and I deal with constant clicking and sticking of my jaw. I wonder if any of this could contribute to my chronic headaches and migraines as well. My mom went to a cheaper ortho who allowed payment plans rather than a more credited ortho who was more expensive. I don't blame her. She did the best she could with what she was given, but my God, I dislike my teeth. One dental hygienist even said mine was the weirdest mouth she'd seen. Story 9. Dentist at Aspen Dental told me that every tooth needs a root canal. I partied too hard years being afraid of the dentist, and it cost me a couple teeth. Answer: sadly, even dentists or endodontists at non-chains do this. I have had 4 root canals, but only one was needed. I have a routine visit Tuesday, and I am dreading it. I didn't have good experiences with dentists in childhood, but all the root canals didn't help. Age 39 now, the teeth simply ached from clenching. There was no infection, no sharp pain when biting down, no hot or cold sensitivity. You would have thought a dentist could determine that, but I paid out of pocket and traveled far to see a better dentist who specializes in TMJ and craniofacial pain. I returned to him when I was told I needed a 5th root canal, and he straight up said the endodontist was scamming me. He said he sees it a lot. Patients come in with a mouthful of crowns or implants that were never needed. This was 10.5 years ago, and the tooth is still fine. Story 10. My mom took me to the ER because of a high fever. I was diagnosed with pneumonia, but for antibiotics, I needed to go to my house doctor. He brushed it off and said I didn't have it. A few weeks later, it expanded on my whole lungs and was very bad. My right lung died forever. I'm 33 now, and that happened when I was like 12. Answer: I had a similar thing happen where I was diagnosed with bronchitis at an urgent care clinic, but the antibiotics they gave me didn't work. I had to go back, and they finally got an X-ray and saw the pneumonia, and I got some stronger meds that cleared me up. This was less than a month before the first COVID cases were being reported from China, so it's kind of eerie looking back. Story 11. They were multiple doctors. When I was a child, I had recurrent UTIs, and they never did any tests and just gave me antibiotics. They ended up having to remove the left kidney. I kept having recurrent UTIs after removing the kidney, and the doctors who operated me kept denying anything was wrong. It was 3 years later that one doctor saw on the exams that they took me 3 years ago that I had urinary reflux, basically urine coming back to the kidney recurrently. He operated me, and I never had any more problems, but I was left with one kidney with decreased function and a serious mistrust in doctors. Story 12. You have hemorrhoids. It's not. Have you heard of CBT? Starts doing CBT and reading philosophy. How much faith do you have in science? Fired by my doctor and received a passive-aggressive letter from the MOAs where, funny enough, CBT could have been used. It wasn't hemorrhoids. It was stage 4 cancer. Left me without a doctor for a year where I almost died in the process. The silver lining is, I finally have a doctor who knows their own field of expertise, still waiting on the specialists. Might die between now and then, might be a stubborn mofo and stick around just to prove a point. Answer: I had a similar situation. My OB-GYN wanted to yank my entire reproductive system since I was bleeding very heavily. We had to do a biopsy, but my employer canceled my insurance. I went on Medicaid, and it was a good 6 to 7 months to get another chance at a biopsy after my imaging. I was written off as substances seeking after admitting the over-the-counter stuff doesn't last long. I got told my uterus should bleed. It was stage 4 endometrial cancer, and I could feel the metastasis that made it stage 4 about 2 years before the official diagnosis. Story 13. Not a doctor per se, but a chiropractor. I was 17, had fallen weird, and my lower back hurt like a Docs and all said go to this chiropractor and he'll help once the x-rays and MRI is in his hands. Well, he figured he'd fix me before they arrived. Lo and behold, ruined my lower spine forever, 'cause he wouldn't wait. Turned out I had a torn muscle, edited due to typo. Answer: My FIL was a chiropractor and straight believes chiropractic care can cure anything. He and MIL were telling us about her sleep apnea and the equipment she has to use to sleep. He then explains exactly what happens with sleep apnea and finishes it off by saying that chiropractic care cures sleep apnea. Bless my sweet husband, who really never says a sharp word to anyone, for saying, "Then why haven't you cured her?" The look on Phil's face as his hard drive spun around was priceless. Story 14. Let my mom, who let her gestational diabetes run rampant, go overdue by almost 3 weeks, have a vaginal delivery. I was just under 10 lbs. And mom is a tiny lady like 4 feet 10. I was completely blue and wasn't expected to live. I have mild cerebral palsy caused by lack of oxygen and head trauma from a violent forced delivery. My mom and dad both definitely have PTSD from it as well. Answer: Ugh. I had the exact same thing happen with my second pregnancy. My gestational diabetes and blood pressure went bonkers in my last month of pregnancy, but the doctor said everything would be fine. My son was almost 10 lbs and got stuck on his way out. They put off giving me a C-section too long and had to violently rip him out as both of our blood pressures were skyrocketing. My son ended up with a broken collarbone and his shoulder ripped through my cunt, taint, and butthole on the way out. I had a ruptured rectum that took a long time to heal, and there was a 50-50 chance I'd never poop normally again and have to get more surgeries. Thankfully, I can poop normally and my son turned out fine. He's a bit of a weirdo, but I don't think the violent birth caused it. Story 15. Told me the lumps on my cervix were just scar tissue and he would contact me if the PAP smear was abnormal. He never did, so I assumed everything was normal. Close to 2 years later, I was diagnosed with cervical cancer, and instead of having a rather simple cone biopsy to have part of my cervix removed, I had to have chemo and radiation, which put me into menopause in my early 30s. Story 16. Putting me on an antidepressant as a child. They never investigated or suggested therapy. My home life was bad and I didn't need a pill. I needed support and a better home life. I have since spent most of my life dealing with the side effects and withdrawal of trying to come off of them. Ironically, doctors continue to deny the reality of side effects, withdrawal being life-ruining. BTW, the substances I was put on, was later sued into oblivion for lying on safety trials for children, and doctors didn't believe me when I said it made me tragic end. Just like the lawsuit revealed. So that first doctor who prescribed it and every subsequent doctor after have caused a domino effect of life-altering consequences for my health. Not sure if they'd admit to the mistake, though. Obvious disclaimer before anyone jumps in to misinterpret. Yes, antidepressants can be helpful for some. Yes, they can save lives. Yes, some people have no issues with them. This isn't about you. This about those who were harmed by them and then gaslit by using those helped as justification. Two things can be true. These substances help and these substances eliminate. It's a sobering tension to hold. Answer. Similar situation, but the shrink put me on a massive cocktail of substances, eventually 8 concurrent meds, a mixture of antipsychotics, for refusing to go to school, due to being constantly physically and verbally assaulted. I was overdosed continuously for over a year, gained a huge amount of weight, and showed signs of renal damage shortly afterwards. I've now been on dialysis for a little over 8 years, and the domino effect of renal failure has been significant. Story 17. Not me, my mom. She had a PAP done, heard nothing, and assumed it was fine. Then 2 years later, mom had abnormal bleeding from the female body part. She's fully post-menopause, for 6 weeks before her doctor did anything. Her doctor just put in a referral and said, no rush, I guess. Finally, she has enough pain to send her to the ER, and they take some scans. Lo and behold, she has uterine cancer. She goes through surgery in less than 5 days, then goes through chemo, and then radiation for the next 10 months. She has more odd pain from her abdomen, and her ER doc tells her, you need another PAPI. Done, just to be sure. But what I want to know is, since your last PAP came back positive, why didn't your doctor do anything? Turns out she also needed a piece of her colon removed after her second PAP came back clear. Her colon had a severe infection that had been eluding her doctor for who knows how long. Anyways, question your doctors, they're people too, fully capable of being awesome or shoot. Story 18. My cat bit straight through the fleshy part of my finger on my dominant hand while I was trying to dose him with a pill. My own doctor was not on duty that day, but there is a walk-in doctor service at the clinic I go to. I had an appointment with a walk-in doctor who looked up the treatment for cat bite on whatever reference system that doctors use, and prescribed me some extra-strength antibiotics. I asked her if she wanted to see the bite because it wasn't just a surface-level puncture wound. He had gone deep through the pad with his top and bottom teeth. She said no. I asked again just to be sure because I didn't think that antibiotics was going to clear this up on its own, but she sent me away without looking at the bite at all. 2 or 3 days later, the pain and swelling was getting so bad that I knew I needed to go back and insist that a doctor actually look at the bite. This time, I actually did get my own doctor. She took a look at it and immediately advised that I was going to need surgery and sent in a referral to the specialist hand surgeon. She sent me home with more antibiotics and the strongest opiates I have ever been prescribed in my life. I had the surgery and was sent home with strict care instructions, more antibiotics, and more opiates. The skin on my finger eventually healed over, and I was able to stop taking the pills. But I am left with permanent, altered sensation in that finger, as well as chronic nerve pain that doesn't respond to traditional treatments. Could any of this have been avoided if the first doctor had just looked at the bite and seen how serious it was when I asked her to? I don't know. Maybe not, but I will always be left wondering. Answer: if it's any consolation, it likely would have happened anyway. Granted, the doctor should have at least looked at it and probably washed it out very thoroughly, but at least you were given a good chance with the antibiotics. I see a lot of patients with really bad infections after cat bites, despite doing everything right. Unfortunately, they are just really nasty injuries. Story 19. As a kid, I was always tired. Like, needed a nap after school, was too tired for afternoon recess. At puberty, I gained weight like crazy while eating next to nothing. My mom took me to the doctor, repeatedly begging for labs for anemia, thyroid disease, and mono. My high school had an epidemic one year. 23 of the students were sick with it. The doctor literally wrote in my chart, "Patient's mother worries too much," and filed the labs without signing off on them. When I was 20 and HEPA passed, I got a copy of my records. You can watch my thyroid die in real time over my teenage years. The labs were so out of range by the time I saw another doctor, I got thyroid hormone replacement right away. It was Hashis. Turned out most of my family has it, but since we all saw the same practice, small town, this doctor missed all of it. One family member's labs were so horrendous, LabCorp called is directly and asked them to go to the ER. They could have died or gone into a coma. It literally stunted my growth. I'm the shortest in now 4 generations. I'm 40 and always cold except when I'm having heat stroke. Literally. I have crappy temperature regulation. I'm still tired more than most people and gain weight way too easily. I've tried different meds, different lab values. Basically, having my first 20 years without enough thyroid hormones has messed some stuff up. And new doctors wonder why I get copies of everything, check my medications at the pharmacy, and have zero chill. Story 20. When I was 13, I started having violent tachycardia and hyperventilating, horrendous nausea, couldn't sleep, and was roasting all the time. Kept happening in school, and they decided it must be that I was becoming a troublemaker and needed therapy. Me, the teacher's pet and gifted student who never had detention a day in her life or raised an eyebrow to an adult. They told my mother to just lock me outside to force me to get on the school bus, until one day I genuinely thought I was going to have my chest burst open, and I begged my mother to help me. She drove me to school, and they told her I should be admitted to a pediatric inpatient mental facility. They stuck me there for a fudge month, while I kept shaking, vomiting, and feeling like I was going to die. The doctor at the facility dismissed me as being overly anxious and attention-seeking. Nothing changed when I got out after a month, and I can't even remember what triggered it. But I got someone to take my pulse, and it was over 200 BPM. They took me to the emergency room, tested me for substances and all sorts of stuff, and the attending came in and took one look at me and said to my mother, "Has her thyroid ever been checked?" No. Because why would they test me when I was just seeking attention? Turns out I had severe hyperthyroidism, the highest numbers that doctor had ever seen in a person under 21, and she came back and told us I have first-year medical students who could have diagnosed this on day one. I was so overloaded with hormones, my body physically could not eat or sleep, and sent my heart into unimaginable rates of tachycardia. I had to be put on adult levels of beta blockers to get my heart rate under control. I had actual damage from it being forced into that kind of beating for so long. I lost the ability to regulate it, and they tried for 2 years to control my thyroid with medication. I was on the highest possible doses, and it was barely doing anything. So when I was 15, I had to take a massive dose of radioactive iodine, I-131, to act as a lethal injection for my thyroid because they simply could not control it. And let me tell you, having to feel and go through one of your organs dying sucks. It sucks so much. I was cold, fatigued, bloated, nauseous, sore-necked for 6 months until they tested my blood. And it didn't work. It didn't work. I had turned into a shadow of myself that was homeschooled and could barely leave the house, and